Have you recently been diagnosed with patellofemoral syndrome, or do you think maybe you are just suffering from patellofemoral syndrome? If that's the case, then stay tuned for an exercise program for patellofemoral syndrome that I've used with my patients for many years, and just an explanation of just what is this patellofemoral syndrome. Welcome to InjuryGuru.com. I'm Carla Schimmelfennig, registered physical therapist. And just what is this patellofemoral syndrome? We also call this PFS for short. This actually involves the femur, or your thigh bone, and your kneecap, or what we call the patella. And it's the joint that makes, and any dysfunction or problem with that joint. It literally means pain to the front of the knee. There are many causes for this patellofemoral syndrome, and I'll share just a few of the most common reasons that we see patients for this patellofemoral syndrome. A lot of times we see athletes, and it's just from overuse, so they're just using that knee too much. Also laborers, so people who have to bend, kneel, squat a lot during the day, go up and down stairs. People who are suffering from arthritis. And another reason is just when that kneecap just doesn't move quite right. It's tight in certain directions and it just doesn't glide and move like it should. So those are the most common reasons of patellofemoral syndrome. But like I said, there are lots of causes. So for some of you, you'll try this exercise program and you will find that it will help. But there will be some of you that try this and it just does not help. It doesn't relieve the pain from that patellofemoral syndrome. So I'm going to ask you to commit to this program for 2 to 3 weeks. And if at the end of that time frame you would say that there is little to no change in your pain, or worse yet, your pain is even worse, then that is your body telling you that you need to get to your doctor or a physical therapist to have them check that out, really do a good thorough evaluation to see the cause of that knee pain for you. And you just need some more intervention. So again, if this exercise program does not work, do yourself a favor, get to your doctor or a physical therapist, let them check that out, and see if there isn't something more that you need for that knee pain. I like to share what my patients typically report or complain of, just because that's helpful for others who are suffering from the same type of pain. So my patients will say, almost always, they'll say that they have pain to that knee, in the front side of that knee, when they're sitting too long with their knees bent in just that one position. They'll also say that they have pain with bending, squatting, kneeling, stooping, and then pain when going up and down stairs. A lot of times they'll say that their knee just gives out or gives way. And they'll also complain of noisy knees, or that they have a lot of cracking, grinding, grating in their knees when they do bend, kneel, or squat, or even going up and down stairs. Besides doing and trying some exercises that I have on this website for you, there are a few other things that you can do to help decrease this pain while you're going through this process. And the first thing that you can do is just try to avoid all those activities that are causing that knee pain. Now, I know that's easier said than done, but as much as you can, try to avoid those activities. Another thing that you can do is definitely don't do any exercise right now that is definitely or has been causing your knee pain. So any deep bending or squatting motion. So if that's causing your knee pain, make sure you stop doing that just for this time period, so we can see if this exercise program is going to work for you. The third thing you can do is some ice and Advil. And I like to tell people, I want you to do ice 3 to 4 times a day. So you can do that at breakfast, lunch, and dinner, or before bedtime. You need to do that for 15 minutes, and that's just some ice right on that knee. It's like an ice bag or a cold pack right on that knee. And you can do that for 15 minutes. It doesn't need to be any longer than that. If you can take Advil, and if you're unsure, make sure you check with your doctor or your pharmacist. But if you can take some Advil, I'd like you to take 2 Advil at breakfast, lunch, dinner, and bedtime. And I want you to do this for the first 7 to 10 days once you get started in this program. Let's get on to the first thing that you're going to do for this exercise program. And this is called patellar mobilization. So what's that? Well, remember I told you the kneecap is what we call the patella. And mobilization just means movement. So you are literally going to be moving that kneecap around in a few directions, and I'll show you what I'll show you what that is. In directions that you determine that your kneecap may be tight or just not moving quite as far or quite as well. So Mason is going to help me show you this patellar mobilization. You might be thinking, what in the world is patellar mobilization? And what that means is that you're just going to move the kneecap around. The kneecap needs to move in certain directions, and I want you to practice and do this mobilization where you're moving that kneecap in certain directions that I show you. So the first one is a medial or pushing that kneecap inward. And you can see Mason is just going to push that kneecap inward. He's just going to let off his pressure and then push it inward again. And when you do this, I want you to do 5 to 6 repetitions. Each one you're going to hold for 10 seconds. Now I'm going to have Mason show you a lateral glide or just pushing the kneecap out to the side. Again, that's what that looks like. 5 to 6 repetitions, holding it 10 seconds each repetition. And one more, which is a posterior glide or pushing the kneecap, gliding the kneecap downward, so down towards your toes. Yep, exactly like that. Thanks, Mason. And then I want you also to try a superior glide, which is bringing that kneecap up toward you or toward your body. And so he has his fingers on the bottom side of the kneecap and just pulling that up. So Mason, can you just put your fingers on the inside and outside of that kneecap just to kind of wiggle it around, just to show people how easy it is to find that kneecap and then move it around. So I always tell my patients, find that kneecap first, move it around a little bit so you know that you can find all the borders of it. You want to find the inside and outside border, the top and the bottom border, so that when you do these mobilizations or these glides, you'll do these effectively. Now, I also wanted to show you in this position with Mason sitting so that you could see it from the front, but now we're going to have Mason lie on a table because that's actually how I want you to do it. I want you to either do this laying on the floor or on a couch or your bed with your knees straight out, so not actually the way we just showed you here. This is Mason now in sitting, and again, I said you could do this just laying or sitting on the floor, sitting on your bed, or even on a couch. I just want you to be able to straighten the whole leg out and have your foot resting on the couch or your bed, whatever you're using. So again, Mason just show us a lateral glide. You can in this video you can actually see that kneecap coming out toward the side. So that's a lateral glide or out toward the side, and then an medial glide, which is bringing that kneecap in towards your other leg, and then a superior glide or bringing that kneecap, pulling that kneecap up toward him, and then inferior glide or pushing that kneecap down toward his toes. Again, you're going to hold those in each direction 10 seconds, and I want you to do 5 to 6 repetitions in each direction if that's what's needed.